I'm very grateful to be able to have used the X10 because it got me out of a lot of pain. I'm well ahead of schedule. I'm more than a month ahead of schedule. I'm beyond a manipulation under anesthesia. I'm having really the best possible recovery anybody could hope to have. I'm Carl Freeman. I've been associated with the X10 for 5 years. I mainly do statistical work for the company, trying to identify patterns of patient progress. This is not my first knee replacement. This was a revision, and it was the third knee replacement in my left leg, and I've had an additional knee replacement in my right leg. So I have experience doing it the normal way with manual physical therapy and doing it with the X10. When it came time for me to have a revision of my left knee, I decided that I would use the X10 exclusively. I didn't have a tenth the pain that I suffered under manual physical therapy. Manual physical therapy would take me 8 to 12 weeks to get over a knee replacement. With the X10, I gave the machine back at 30 days, and I really could have given it back sooner. The X10 is head and shoulders above any other technique for recovering from knee replacement. When I saw my surgeon at our 2-week appointment, he came in and he said, "So I see you have 0 degrees extension and 130 degrees range of motion. That's absolutely unheard of." I've looked at hundreds upon hundreds of studies. The range of motion a patient starts out with is critical in determining the range of motion that the patient ends up with after surgery. This led to a question, which is, if we use the X10 for prehab before people have their surgery, does it increase their range of motion and does it increase their strength going into surgery? And that answer is an unqualified yes. I mean, data excites me. Getting good data, seeing people actually recover, having this tremendous recovery with less pain, less cost to the insurance and healthcare system, that's really exciting.